the key thing here, well, one of the issues whenever we're talking about masking is that obviously everyone's got a very strong or a strong opinion on this, and you're going to get different takes from different people. My bias here is that I think masks work reasonably well. Of course, they're not perfect, but they can certainly blunt the impact of a wave. They're not going to stop it, but really they protect the individual wearing the mask, and they also help protect more vulnerable people among us. I'd keep the masks on for now. I would. I think it's a very reasonable thing to do. It's a rather light touch intervention, all things considered. You know, you never want to see businesses or schools closed, but putting on a mask or keeping masks on, at least until this wave starts to recede, I think is a very reasonable idea, and it will help save lives and help protect more vulnerable people among us.
And we're also looking as well, Dr. Bogoch, at the long-term effects of COVID for those that have been infected by it, those long-term symptoms, the long COVID that we've been talking about. A great deal of debate, and I know that you've been looking at this as well, in terms of who's experiencing what and how the various variants affect people.
Yeah, I mean, there was an interesting study that came out that suggested that some variants might be more prone to an individual developing long COVID versus other variants. In all fairness, I think this is a vastly understudied area, and we still need to learn a lot more about it. I think there certainly there's been some progress in over the last year in terms of our understanding of this, but we have a long way to go. Who's at risk for developing this? How long do those symptoms last? How do we improve and support people through this? What is the actual true incidence of this as well? I think that's still yet to be determined. So this is a major area that requires study and, of course, support for people who are impacted by this.
Do you think we should also be maintaining, or perhaps maybe going back to more regular testing, not necessarily the PCR testing, but the rapid tests, as you've pointed out, they can be quite helpful, at least, you know, in terms of giving people an indication of what their situation is. That's really sort of fallen to the wayside.
Yeah, we sort of seem to have one extreme or the other. It doesn't really make a lot of sense. There was a time where, you know, anybody could go get a PCR test who was completely asymptomatic. I think, you know, that's not really necessary. On the other hand, now I think it's obviously extremely challenging to get a PCR test. Rapid tests are increasingly available. I think we can put those to good use. But again, even with PCR tests, even making those a little bit more available to people who, for example, have compatible symptoms of COVID, I think it's pretty reasonable and can help guide good decision making. You know, if someone tests positive, they know that they should isolate. They know perhaps others around them might want to get tested should they develop symptoms as well. So I think we could scale that up a little bit, but by no means do we need to be in a position where we're at before, where, you know, everyone was coming out in droves for a PCR test who had no symptoms whatsoever.
And we had those long lineups. Really quickly before I let you go, then, your best advice in terms of how people should socialize. There's a great debate on that as well, with restrictions being laxed. Quebec's looking at its mask mandate. We'll know more. Ontario, we know by the end of the month or so, the masking requirement will be fully lifted. So what do we do?
Yeah. Well, I mean, listen, while we have a lot of COVID circulating in the community, I think it's still a very good idea to keep a mask on in an indoor public place. And again, I think we've under-vaccinated certain individuals and communities. People might be eligible for dose 1, dose 2, dose 3. It's a great idea to go get those vaccines. Rapid tests are still around and still helpful if you're gathering in a small group and you want to make sure no one's contagious or transmissible to others. You can still rapid test. Those are still very helpful. And you know what? I think people should be aware that there's a growing access to COVID therapeutics. And if people are sick with COVID and have risk factors for severe illness, many people can get treated now out of hospital, and that will actually help prevent them from getting sick enough to land in hospital. And I hope to see more expansion, or greater expansion of that as well. So there's a lot that we can continue to do to keep ourselves safe and keep those around us safe.
Indeed. Always great advice from you, Dr. Bogoch. Really appreciate it. Dr. Isaac Bogoch, infectious disease specialist. Talk to you again soon.
Have a good one, Angie.
You too.